Usui Ryoho Reiki Level 2 Manual by Neil Cooper. This manual is copyright to Neil Cooper 2024. Reiki Manual Part 1 of 6. Heading: Reiki Practitioner's Second Degree Akuden Reiki Level 2. Once attuned and certified, it qualifies you as a Reiki practitioner and therapist. Remember that Reiki healers should use their gifts wisely and humbly put their egos to one side. Reiki practitioners channel healing energies from a higher force. Healing is to be done without discrimination or judgment of the client. The client's confidence and trust should not be broken at any time. Always adhere to a code of good conduct with both moral and ethical standards when it comes to clients. Heading: Reiki is a complementary therapy. Reiki is a complementary form of therapy, as it aids natural self-healing and recovery. It can help alleviate some symptoms and conditions and is very useful at addressing stress, anxiety, and sleep issues among other things. However, it is not a medical treatment. Reiki is a form of light touch and hands-on contact healing that can be given through the aura, in proximity to the client, or at any distance to life, including people, animals, and plants. Reiki is a non-intrusive therapy and only works for the greater good. Since Reiki is a complementary therapy, it is not meant to replace any other form of medicine, nor is it an alternative medicine or treatment. Reiki healers should never offer a diagnosis to their clients, and they should always encourage their clients to seek a medical opinion if their symptoms persist. Healers should in no way advise clients to stop any medication they are prescribed or are currently taking, nor should a Reiki healer suggest any medication to a client. Reiki healers are there to pass the Reiki healing energies to the client and no more than that. Never promise a cure. Reiki is not a miracle solution, but it helps natural self-healing take place where possible. Heading: Charging for Reiki. As a Reiki 2 practitioner, you can charge, accept a donation, or give Reiki freely as you wish. Many Reiki healers feel an exchange of some kind should take place for the worth of the healing that is being given. It is often thought there will be more appreciation through an exchange. Keep in mind that the healing is given freely from the healing source energies that Reiki practitioners receive. As a result, the Reiki practitioner is charging for the value of their time and skill rather than for the healing itself. In Japan, Usui Sensei, Dr. Hayashi, and other Reiki healers charged only what people could afford. This was called the middle path, and one could make a living from it. Those with more gave more, but those who were being treated and had little were charged only a little. For those who could not afford the healing, it was given freely. This philosophy is in the true spirit of Reiki, because it is truly about helping others and not how much can be charged for it. It was Madame Takata, a Japanese immigrant living in Hawaii, who brought Reiki to the West and also taught that it should be charged for. Madame Takata initiated 22 Reiki masters, and they each had to memorize the symbols, hence why some appear different to others. However, all will work no matter how they are drawn. It has come to light that both Usui Sensei and Dr. Hayashi gave out manuals to many of their Reiki students. Additionally, they performed attunements either for free or for a charge depending on the circumstance of the individual. It was the wish of Usui Sensei that Reiki be spread far and wide around the world. Heading: Other spiritual abilities or services. Other spiritual abilities or treatments should not generally be mixed when giving Reiki treatments. However, this is for the individual to decide. If you have other spiritual abilities that aid in your healing, such as intuition or being guided by a Reiki healing guide, that is fine. However, if you provide psychic or mediumistic readings or other therapies, those are best done separately. Some clients are not always open to other abilities, so it is often better to arrange a separate time if they show an interest in another service that is offered. It is important to note that crystal healing is used by some Reiki healers, even though it is not part of traditional Reiki. Heading: Clients. To begin with, it is best to refer to those who come for a session as a client or clients rather than a patient, as patient is a medical term. Clients will be receiving Reiki sessions or treatments. It is best to tell the client that a Reiki treatment is a session, as some may feel uncomfortable if it is referred to as a treatment. When explaining Reiki to clients during their first session, inform them that Reiki is life force energy healing that will heal and replenish any energies within him as needed. Explain to clients that Reiki will help to clear blockages and bring balance and harmony to their whole selves in a holistic manner. This energy will help to speed up natural recovery as well as ease the pain and suffering of the mind and body. Practitioners should always be willing to explain in more detail what Reiki is and how it works if a client asks for additional information. Before a healing, make sure clients are aware that they may experience different sensations during the healing. For example, warmth, coolness, or even tingles and colors in their third eye. Be sure to let them know that Reiki heals and lifts away whatever needs to be removed and released. It is also wise to inform clients that there may be a mental or emotional release after the healing or the following day. This may be more minor or it may be a full-blown healing crisis. Make sure the client is aware ahead of time that they may experience a little discomfort when the healing lifts away physical or mental blockages. Also let them know that any depletions of their energy bodies will be healed and replenished. Don't be afraid to be honest with your client about what they can expect from a Reiki session, before, during, and after the healing has taken place. For many, information and awareness are what ensures that they feel most at ease during the Reiki session. Heading: Is hands-on healing allowed in your area of the world? Reiki works best through hands-on healing, then via the aura, then in proximity through beaming or projecting it in the same room or same house to the client, and then by distance through distant healing. However, in some parts of the world, such as in the USA, in some states, there are laws prohibiting the laying of hands to the body of a client, other than doctors and registered masseurs. Please check if this is the case in your part of the world or state before giving hands-on healing. If hands-on healing is prohibited, provide healing via the aura energy field with the hands 3 to 5 inches off of the body. This works best in most cases, although aura healing can sometimes be as much as a couple of feet off of the body and will still work very well. Heading: Hands-on healing over sensitive areas. Before commencing the first healing with a client, ask them to fill out a form and sign, date the form. Ask them to state whether or not they are comfortable receiving hands-on healing. It should also state that the hands will not be laid on sensitive areas. Confirm this verbally before starting any Reiki healing session. Be sure to ask the client whether they have received Reiki or hands-on healing before. Always communicate what is involved ahead of time and ask if there are any areas where hands-on healing is not desired. It is especially important to check in with clients who are pregnant or are trying for a child. There may be a desire for the healer to avoid the womb area. Though Reiki healing cannot cause harm, the comfort of the client must always be the priority. You can also ask if any areas of the body are painful to the touch to avoid hands-on healing there as well. Heading: Areas to avoid giving hands-on healing. There are areas where it is essential to avoid hands-on healing for the comfort of the client. Reiki practitioners should avoid putting their hands directly on a woman's breasts and avoid healing directly on the posterior, crotch, and inner thighs for both men and women. Instead, Give hands-off healing over these areas through the aura. When healing the heart chakra area of women from below the breasts, do not place your fingertips any higher than the bottom of the bra wire area. When near the base of the spine, heal above the root chakra with the palm pointing up the spine on the small of the back above the posterior on men and women. Heading: What should be avoided? Professionalism is essential during a Reiki session. As such, there are certain actions that should be avoided. The healing will pass adequately and most freely through clothing, so there is no need to ask the client to take off clothing other than a heavy coat if it is warm enough in your healing area or room. If your healing area is not warm enough, you can place a blanket over the client to make sure they are warm and comfortable. Do not undo or put your hands under clothing to touch the skin other than the face, arms and lower legs. Inappropriate touch should always be avoided, as the comfort of the client is most important. Heading: How Reiki healers relate to their clients. When relating to the client, it is best to keep it professional. However, that does not prevent the healer from being friendly and understanding. Some clients do not wish to share their problems and just wish for healing, while others will sometimes share very private details. You should ensure that all personal and private information shared is confidential and locked away if it is written down or if any audio recordings are kept. Something important to remember: Reiki healers are not counselors, so be very careful about offering advice to clients. The only people you might share limited information with are other Reiki practitioners. This should be done in confidence with another Reiki practitioner of the same level or a Reiki master, if you need to consult with him for help or advice. Also important to note, Reiki practitioners should not judge those who come for healing, or those the client might speak of, no matter what your personally held beliefs or thoughts are. Always remain neutral and impartial rather than take sides. However, it is appropriate to offer words of comfort. As healers, there should be a level of compassion for those who come for healing. Reiki practitioners should always give the healing with care, compassion, and love, but it is also important to place a barrier of light and protection around yourself. It is not wise to take on the burdens or problems of clients. Maintain a level of professionalism and keep your feelings about a situation semi-detached. Even if you naturally sympathize with your client, try not to take on their burdens. After the session has ended, it is important to close the door on the situation rather than walking around constantly thinking of their situation or how to assist. It is the role of the Reiki practitioner to heal and help facilitate the opportunity for the client to self-heal. Ultimately, this is their journey. Even if you would like to change a situation, it is not always possible to do so. Focus on remaining professional and impartial. Make it clear to the client that the Reiki will work to address their needs.